The CDC is expected to relax some of its COVID guidelines as early as this week, but with a high number of cases in California, should the state implement the new guidance? Thanks for staying with us here at 5:30. I'm Adrienne Moore.
And I'm Curtis Ming. We're streaming right now on CBS News Sacramento, and the two biggest possible changes for students: COVID testing and social distancing. Pediatric infectious disease Dr. Dean Blumberg joins us tonight.
Dr. Blumberg, thank you as always for being with us. We always appreciate your perspective here. So let's just dive right into this. Is it safe for schools to loosen these protocols with cases still high in California?
I think this is very pragmatic guidance, and especially considering that in April, CDC released data that showed that 75% of children and adolescents had already been infected with COVID. So there's already some partial immunity in this population, which is going to make subsequent infections less severe.
All right, well, the CDC says they could get away with relaxing these rules because more of us have antibodies, but how does that really impact kids in the classroom?
Well, I think if you do relax these protocols, it does increase risk of infection, but we fully expect that these breakthrough infections are going to result in relatively mild disease. So we don't think it's going to lead to an increase in severe disease, such as resulting in hospitalization. And parents and children who want to continue to really minimize their chances of infection, they can continue to do so by wearing masks, including wearing N95 or KN95 masks.
Yeah, we know so many parents are out there. I've seen a lot of them in the stores already getting those masks before the first day of school. But we want to talk about quarantines as well. We know the CDC is expected to say that those exposed to COVID no longer need to quarantine to do it, vaccinated or not. Instead, they say kids should mask up for 10 days and then test 5 days after exposure. So how risky do you think this could be?
This is similar to guidance that CDC provided to healthcare workers who were fully vaccinated or healthcare workers who were unvaccinated and had lower risk exposures. And so this has worked out quite well. The masking after they've been exposed can result in decreased risk of transmission to others. And then again, the other people who might be exposed can minimize their risk of infection by continuing to mask.
All right, well, it's a balancing act as we progress and navigate this new way of living. Thanks so much. We appreciate it as always.
Great, thank you.